Knock, knock.
Yes.
I'm Mr. Dixon.
Hi.
My name is Michael and I'm your nurse today. I'm here to perform series of assessment. We're going to start with the neuro assessment, and we're also going to do the cerebral function assessment, and we're also going to go down to the sensory assessment, and finally we're going to do some reflexes. I'm going to wash my hands and provide some privacy. I'm also going to identify my patient. Because of this test, we're doing this a test. Well, normally the patient is in a gown, but because of testing, we don't have the patient in gown. We're first going to start with the neuro test. We're going to go through the 12 cranial nerves. We're going to start with the first cranial nerve, which is the olfactory nerve. That is to test your ability to smell. And normally we're going to have the patient to clean his nose and maybe through a towel blow his nose. We're going to use an alcohol wipe while the patient cause one nose. We're going to give him the alcohol wipe so he can smell it. We're going to do it bilaterally. The ability to smell regular scent is normal. Inability to smell any kind of regular scent is abnormal, and further testing will be required. After that, we're going to go to the cranial nerve 2, which is the optic nerve. We're going to do assess your visual acoustic and also the visual field. We're going to do the smelling test. For that, normally we're going to have a bowl, a chart up for the patient can read a couple of letters, a number, and the patient ability to read the numbers is normal. Inability to do that is abnormal. We're also going to test the patient visual field. I'm going to go from your back to your front, and when I'm coming, just show your finger out that you see my hands. And I'm going to go with this, and I'm going to move up. I'm going to move down. The patient is able to see with my finger coming from both directions. That is normal. After that, I'm going to check the constriction of the temporal and maxillary muscle. I'm going to ask the patient to crunch his teeth, and I'm going to pit the maxillary and the temporal muscle. And I'm also going to come down on his cheek, and his muscle contract bilaterally, and that is normal. And that is where the cranial nerve 5, which is the trigeminal nerve. Also, the trigeminal nerve, we're going to check for sensation of the face. I'm going to ask the patient to close his eyes and say yes when he feels my finger touching his face.
Yes. 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 Yes.
And that is normal. The patient is able to identify sensation. Inability to identify sensation, it may be due to lesion of the trigeminal nerve. After that, we're going to go to the papillary reflector light, and that is cranial nerve 2 and 3. And I'm going to test locality of pupil. I'm going to go from this eye and direct, and also going to look at the retina in the middle, and the light should reflect on both sides. And we're going to go in the middle of the bridge of the nose, and your pupils so come together and they should constrict, and that is normal. After that, we're going to go to testing of the cranial nerves 3, 4, and 6, and we're going to do the extraocular motion. I'm going to have you to look at my finger and follow it as I go along. And we're going to go clockwise. And the patient was able to follow my finger clockwise with the pupil moving one side. Inability to do that is abnormal. And I'm also going to come closer, which is accommodation. And coming closer to the patient, the pupil kind of constrict, and going forward, it moves further away, it kind of dilated, and that is normal. And after that, we're going to test the cranial nerve 7, which is the facial nerves. I'm going to ask you to do a series of things. I'm going to first ask you to smile, and then frown, and I'm going to ask you to show me your teeth, and I'm going to puff air in your cheek. Good. And then after that, I will ask you to close your eyes and open your eyes, and that is normal. Inability to perform any of those tasks is abnormal, and further testing will be required. Now we're going to go to testing the acoustic, cranial nerve 8, and I'm going to ask the patient to identify the sound. I'm going to start with the verbal test. I'm going to put this on your head and tell me that you hear noise in both ears.
Yes.
And after that, I'm going to do the Rayner test. Going to put it on your master bone. Tell me when you stop hearing off.
Yes.
And then I'm going to put it to your ear. Normally, air conduction is greater than bone conduction, and that is normal. Inability to hear the noise is abnormal, and further testing will be required. After that, we're going to assess the cranial nerve 9 and 10. After that, before we go to assessing the cranial nerve 9 and 10, I'm also going to do the whisper test too. I'll ask the patient to close one ear, and I'll whisper a few words. 1, 2.
1, 2.
And the other one. 1, 2.
1, 2.
And that was normal. And after that, now we're going to go to cranial nerve 9 and 10. I'm going to ask the patient to swallow. Good. And I'm also going to ask you to open your mouth and say ah. I'm going to look at the soft palate, and the uvula should be able to go up and down. And that is normal and it's symmetric in mainline. And after that, we're going to test the cranial nerve 12. I'm going to ask the patient to rest the tongue and protrude the tongue. Open your mouth and move your tongue from side to side, up and down. That is also good. Inability to do any of those is abnormal and further testing required. And we're also going to do cranial nerve 11. I'm going to ask the patient to shrug his shoulder up and then move your head against my hand on the other side. And the patient is able to contract, and his trapezius muscle contracted well, and the sternum called domestic muscle was also contracted, and that is also normal. And at this time, we're also just going to do cranial nerves also 12. Listen for articulation. I'm going to ask the patient to say his name. Okay, and we're just going to listen for his speaking, and his speaking is not slow, so that is normal. After that, we're now going to go to the cerebral function test. We're going to ask the patient to point his finger and his nose and point it to my finger. I'm going to move it from different direction. And also, I'm going to ask the patient to point his finger to his nose, alternating with each hand, and do it faster as he can. And the patient is able to do it with rapid movement and no deviation. That is also okay. And I'm also going to have you put your hand on your palm, up and down, palm and supination, faster as you can. And the patient is able to do that faster, and that is good, and that is showing control of his motor of ability, and there is no weakness of his muscle, and that is also normal. At this time, we're also going to go to ask the patient to move his heel against his shin, and the other one, and the patient is able to move his heel against his shin, and also that is normal. Inability to do that is abnormal or cause some muscle weakness, and further testing is required. Also, we're going to do we're going to ask the patient to stand. I'm going to do the Ramner test, the Brambury test. I'm going to ask the patient to close his eyes and put his feet together, stand still for at least 20 seconds, and he's normal. He's not swaying or moving from side to side, and that is also normal. I'm also now going to watch the patient as she walk normally. I will take the walk normal forward. Okay, and come back on your heels. Come back on your heels. Good, and then go back on your toes. Now come back with 1 foot in front of the elbow, which is the tender sound test, walking. And that is normal. Normally, if the patient is, when they're doing the other tests, like walking on their heel and on their toes, tests abnormality that you will not observe when they're walking regular, you will be able to catch that when they're walking, doing the other walks. After that, we're going to do the shallow knee bend. We're going to ask the patient to go down on one knee and up and do it on the other one. and that is normal. The patient is able to do the shallow knee bend. And now you can have a seat. Now after that, after this, I will do this scoliosis test. I'm going to look at the patient back, the symmetric of his back, and I'll hold on to his hip and ask you to go down and come back up. The back is symmetrical. There is no deviation of his spine, and that is normal. And you can have a seat. We're now going to do the sensory test. We're going to assess for pain. I'm going to and I'm going to show you this is dull and this is sharp. So just let me know when you feel them. You can close your eyes and tell me which one you feel.
Dull, sharp, dull, sharp, 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 dull.
Thank you. And the patient ability to sense dull and sharpness is normal. Inability to recognize sharp and dull pain is abnormal, and further testing is required. We're also now going to the vibration. First, I'm going to pull it on one of the finger, and tell me if you first you can close your eyes. Okay, and tell me when you feel it.
Feel it.
Feel what?
Vibrating.
Good. Now I'm going to go to his great toes. I'm going to put on his great toes.
Feel it.
Good.
Pulsing.
And put it on the other great toes.
Feel it. Pulsing.
Great. And the patient is able to identify the vibrating sound, and that is normal. Now we're going to test his reflexes. I'm going to start with the brachial reflexes. We're going to come right in the middle there, and then I'm going to hit good. And the patient should be, his elbow should be able to flex at least +1 to +3. Inability to do that is abnormal, and further testing required. We're going to go to the tricep. We're going to go right above the elbow, and we're going to hit it, and it should be able to extend, and the tricep muscle should be able to contract. And inability to do that, that is also abnormal. We're also going to go to the brachial radialis. I'm going to go 2 fingers above there, and we're going to hold on to this, and it should be able to flex and supinate. And inability to do that is also abnormal. We're going to go to the papilla, test the papilla reflex. If you can relax your knee, we're going to go right below the knee, right down there, and we're going to heal it. And his knee should be able to extend, and that is normal. And we're going to go to the Achilles tendon, and I'll hold it like this, and I'll hit it, and the patient should be able to plantar flex his leg, and that should be normal. And after that, I'm going to go to the patella and the basket. A test for that. We're going to go under the feet, and then we're going to go up, and the patient should be able to feel the sensation as we go up. And that is pretty much it. And I'm going to tell you thank you, sir, for allowing me to work with you. I'm going to wash my hand, and thank you.